there have been a couple of papers which have come out. They're kind of pre-peer review papers in the last week. And they were suggesting that there might actually be a much greater risk or significant greater risk of mortality for people living with HIV if they did acquire COVID. And what's your thoughts on these papers?
Yeah, so I think obviously all of our HIV patients ask this question when they come to clinic, right? Am I at a higher risk, particularly with more advanced immune suppression? And we were really not able to answer that in the beginning because we had very little data. Since then, since the first cases appeared, there have been 15 case reports published, mostly from Italy, Spain, so the two European countries which were hit first in Western Europe, and then the US. And really, if you look at these studies there, and then obviously German studies followed, and all of them really do not report too much difference in the outcome. So they basically say hospitalization rate, mortality rate is relatively comparable to the non-HIV infected population, and the same kind of risk factors apply, comorbidities, and the older patient.
And which are the most kind of significant comorbidities, would you say?
Diabetes and cardiovascular disease.
Right.
And that may have to do that COVID can also involve the heart. So obviously those patients are more prone to cardiovascular complications also from COVID disease. And I think these cases here sort of all made us feel like, wow, it's not that bad. We have 1,200 patients in our clinic. 7 patients developed COVID-19. Some of them were hospitalized. No one died. They're all doing well. So like if you would ask me, I would say everything's fine. But then one UK study came at the BIVA meeting, which reported for the first time just in hospitalized patients that there was a 63% higher probability of dying from COVID-19. And then probably the largest study, and I think that's one of the issues when we come also to the second UK study, is that obviously the prevalence of HIV is different in different parts of the world. So really the Cape Town study, which is looking at a very large number of patients who are getting medical service in that area, millions of people, they identified thousands of patients, including over 4,000 HIV patients. They had 115 deaths in HIV patients with COVID-19. And in their analysis, there was a 2.3-fold higher risk for dying from COVID-19. And that was probably the largest cohort which has looked at that. And that's obviously something which is kind of serious because the numbers are much larger. And you can say, well, if you have small cohorts, you just by luck, maybe you're treating a younger patient population and you have a different distribution of risk factors. I think one of the issues which was raised, though, that some of the baseline parameters like socioeconomic status and also issues around BMI are not captured. We know that in Africa from some of the trials that actually BMI is going up steadily, diabetes rates are higher. Does that contribute? This is a more vulnerable patient population? And then obviously there also needs to be a stratification for virologic control and CD4 count and so forth. So that sort of was alarming. And then the second UK study, which was just published a couple of days ago, although it still has to undergo peer review, sort of suggests also in a much larger NHS-based survey in all the patients, but again, a very low number of deaths, around 26 in HIV patients, that there was a 2-fold higher risk of dying in the setting of HIV infection and COVID-19. And that was a correction for age and comorbidities and so forth. So I think there is at least a signal now coming from some of the cohort analysis, but as you have with non-peer reviewed papers and low numbers, it can always go one way or the other, depending if you have a kind of negative distribution of certain risk patient groups or populations. So it really
because in the UK cohort, at least, I mean, I know that in one of the papers they're talking about 25 cases of mortality, and in the other paper they're talking about 26 cases of mortality. So I mean, it's very hard, I guess, with numbers that small to kind of draw conclusions about the cause. Is that right? I mean, that it's difficult to draw more conclusions.
Well, they spent a lot of time trying to look at that in overall terms and say that even with these small numbers, they can draw valid statistical conclusions. So they have addressed that point. But I have to say, one thing we shouldn't forget: if the low number tells you that of the larger number of people who get infected, there still is a very low mortality, which is probably less than 1%. So I think that's one reassuring thing. It doesn't mean that if you have HIV and you get COVID-19, you're going to die. No, you're much more likely not to die.
And I think that's probably the question which is going through people's heads right now. And that and do people with HIV need to shield? I guess is a big question.
Yeah.
And what's your thoughts on that?
So my general thought is that they should do exactly the same as everyone else. So social distancing, the hygiene rules should be applied. I think it's important to make sure that you have your vaccination against other bacterial pathogens. So pneumococcal vaccination, influenza vaccination when the influenza season comes up, I think is important to make sure you don't get other pathogens which could aggravate the course. And I think having undetectable viral load, as in any other infection, is important, that you have good control of your HIV infection. I think that risk factors like diabetes and obesity play a role. So this is clearly a moment where you should be thinking about weight loss if that is an issue for you personally, and exercising and all these things which are good for you remain good for you and are probably even more valid in this time.
Right. Thank you.